In the middle ear cavity, you have superior to it, there is the middle cranial fossa. As you know, the middle cranial fossa contains the temporal lobe of the brain. And inferior, we have the jugular bulb, in which the internal jugular vein is present. So superiorly, the middle cranial fossa, in which the temporal lobe of the brain is present, and posteriorly, the internal jugular vein. Anteriorly, we have three structures. From up down, we have the canal for tensor tympani muscle. Okay, we just talked about it, which attached to the handle of the malleus. Okay, you can see it in the previous videos. And we have the other canal, which is the Eustachian tube and the internal carotid artery. So superior, we have the temporal lobe of the brain in the midcranial fossa, and we have the internal jugular vein below, and anteriorly we have the tensor tympani canal, Eustachian tube, and internal carotid artery. Posteriorly, we have, this is the facial nerve. Okay, this is the facial nerve running here. Okay, so posteriorly we have the facial canal in which the facial nerve runs, and we have the antrum, which is the opening which opens onto the largest air sinus in the mastoid. This is the mastoid bone. Okay, so posteriorly we have the facial canal, we have the antrum for the mastoid air cell, and we have the pyramid. And this pyramid is the site where the stapedius goes to get attached to the think with me, to the neck of the stapes. So we have up, so a patient is looking forward here, he's looking here. Okay, his eyes are toward this side, and his ear is present here. So here is up toward his brain, here is down toward his neck, and this is lateral, and this is medial, and this is posterior, and this is anterior. In the roof of the middle ear cavity, we have the middle cranial fossa containing the temporal lobe of the brain. Inferiorly, we have the internal jugular vein. Anteriorly, we have the tensor tympani canal and the Eustachian tube and the internal carotid artery. Posteriorly, we have the facial canal, which is running vertically, the vertical part of the facial canal, and we have the antrum of the mastoid air cell, and we have the pyramid in which the stapedius go to attach to the neck of the stapes. But laterally, which is here, so we are going here laterally, we have the tympanic membrane. But medially, we have something called the promontory, in which behind it there is the cochlea, and we have the oval window in which the food process of the stapes lies, and we have also the round window in which there is the secondary tympanic membrane. The other structures which we are going to talk is the inner ear. The inner ear, or the labyrinth, is formed of the semicircular canals, the vestibule, and the cochlea. Semicircular canals are superior, the lateral, and the posterior. And here we have the utricles and the sacules, and the semicircular ducts, and we have here the cochlear ducts. Of course, the inner ear is supposed